Right now, sitting inside your medicine cabinet, inside your purse, inside the little pill organizer on your kitchen counter, there are substances that most people over 60 treat as casually as drinking a glass of water. You take them for your joints. You take them for your blood pressure. You take them for heartburn, for cholesterol, for a sinus infection that just would not quit. And you do this because your doctor prescribed them, or because you have bought them off the pharmacy shelf for years without a second thought. Here is what nobody has properly told you. Older kidneys may process medicines more slowly, making them more vulnerable to damage from certain drugs. The kidneys sitting inside your body right now are not the same kidneys you had at 40. They have changed. The kidneys may become smaller in size and lose some of their filtering units, which makes them less efficient at removing waste and extra fluid from the blood. And when medications that were once tolerable begin passing through kidneys that are working at diminished capacity, the consequences can be catastrophic and almost always silent until it is too late to easily reverse. Today I'm going to give you a list you need to study carefully. Not to frighten you into throwing your medications away, but to give you the knowledge to have a genuinely informed conversation with your doctor. 10 medications that carry serious risk for your kidneys after 60. What they are, why they do the damage they do, and exactly what to do instead. Stay with me for every single one. Drugs cause approximately 20% of community and hospital-acquired episodes of acute renal failure. And among older adults, the incidence of drug-induced kidney damage may be as high as 66%. Read those numbers again. 2 out of 3 cases of medication-related kidney injury strike older adults. Not some rare population with unusual genetics. People like you. People like your neighbor who takes the same blood pressure pill every morning before breakfast. The reason this matters so urgently after 60 is rooted in pure biology. The glomerular filtration rate, which is your kidney's ability to clean your blood, decreases steadily after the age of 30 and drops more rapidly after 65. Think of your kidneys as a coffee filter in a machine that has been running continuously for 6 decades. The mesh gets finer, then fragile. A tablespoon of grounds that would have passed through cleanly at age 30 now clogs the filter, backs up, and burns the whole machine. One of the most critical consequences of this decline is the accumulation of drug metabolites in the blood, giving rise to potentially unknown pharmacological compounds whose effects are entirely different from what was intended in a healthy patient. Most doctors are aware of this problem. What they do not always do is communicate it directly to you. That ends today. Now here's where things take a turn most people never see coming. The first 2 medications on this list are the ones most likely sitting in your cabinet right now, being used without any worry at all. The first is ibuprofen and its chemical cousins, the entire family of drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. This means naproxen, sold as Aleve. It means meloxicam. It means celecoxib. These are the pills millions of older adults reach for when a knee aches after a long walk, when a shoulder tightens in cold weather, when arthritis makes the morning feel like punishment. This class of pain medicines lowers the amount of blood flowing to your kidneys, which raises blood pressure inside those organs and causes kidney damage, especially with high doses and long-term use. Picture your kidney's blood supply as a garden hose. NSAIDs are like someone standing on that hose. At first, the restriction barely matters, but held long enough, the plants wither. If taken for too long, NSAIDs can cause damage by reducing blood flow to the kidneys. And if taken when you are dehydrated or when your blood pressure is low, they can cause acute kidney injury within days. The second medication in this category is aspirin, specifically high-dose aspirin taken daily for pain. Many people assume aspirin is harmless because it is old and familiar. Chronic use of aspirin at high doses, more than 1 gram daily for more than 2 years, has been linked to chronic interstitial nephritis, a form of kidney damage that can silently progress to end-stage renal disease. The pharmacy shelf treats these like harmless options. Your 60-year-old kidneys experience them very differently. And if you think that was alarming, the next 2 items reach even further into your daily routine. Most people believe they already know the answer to this. Most people are wrong. Medications 3 and 4 on this list are ones prescribed by your doctor. Drugs that are absolutely necessary for millions of seniors, but that require a careful ongoing conversation about their effect on kidney function. Number 3 is the proton pump inhibitor family. You likely know these as omeprazole, sold as Prilosec, or lansoprazole, sold as Prevacid. They are given for acid reflux, heartburn, and ulcer prevention, and they are among the most prescribed drugs in the entire world. Many people take them every single day for years without ever reevaluating whether they still need them. PPIs, like omeprazole and lansoprazole, help reduce stomach acid and are among the most commonly prescribed drugs, but long-term use and sustained higher doses have been found to increase the chance of kidney disease. The damage here is not dramatic or fast. It is slow, cumulative, and largely invisible until a blood test reveals that something is very wrong. Number 4 is diuretics, the water pills your doctor may have prescribed for high blood pressure or fluid retention in your legs. Furosemide, hydrochlorothiazide, spironolactone. These drugs do exactly what the name promises. They flush water from your body. Doctors use diuretics to treat high blood pressure and some kinds of swelling because they help the body get rid of extra fluid. But they can sometimes dehydrate you, which can be seriously damaging to your kidneys. Picture the scene. An older adult who takes a diuretic every morning, goes to a family gathering on a warm afternoon, walks around, sweats a little, forgets to drink enough water, and comes home feeling tired. What that person does not feel is the reduced blood flow quietly stressing kidney tissue that has less reserve than it did 20 years ago. Older kidneys may already have trouble conserving water, which makes dehydration more likely. And when dehydration collides with a drug designed to remove fluid, the risk multiplies. This is the reason I decided to make this video in the first place. To understand why, we need to look at what is actually happening at the cellular level. Medications 5 and 6 take us deeper into something that will genuinely surprise you. Number 5 is a category you would never expect: certain antibiotics. Not antibiotics in general, but specific ones, including the fluoroquinolone family, which you may know as ciprofloxacin or levofloxacin. These are commonly prescribed for urinary tract infections, respiratory infections, and skin infections, conditions that strike older adults frequently. Fluoroquinolones should be used with caution in elderly patients because they can cause heart rhythm issues, and in rare cases, both older and newer fluoroquinolones may cause acute interstitial nephritis or acute kidney injury. There is also the danger of leftover antibiotics, the ones sitting at the back of your medicine drawer from an infection 6 months ago. Many people do not finish their antibiotic prescriptions and keep the extras in their cabinets, then self-medicate with leftover antibiotics when they feel unwell, which is not only ineffective for viral illnesses, but may cause acute kidney complications. Think about your bathroom medicine cabinet for a moment. If there are old pill bottles in there from prescriptions past, this is the week to clean that cabinet out. Number 6 is a category that will unsettle people who have been told it is a long-term safe medication: lithium and certain psychiatric medications. Lithium treats mania effectively, but it can harm the kidneys at higher doses or over very long periods, with the most common problem being a condition where your body has trouble concentrating urine, causing it to remove large amounts of water and leaving you very thirsty. This excessive urination is often dismissed as just getting older. It is not. It is a signal. But what comes next on this list changes the conversation completely, because number 7 involves a medication that many people take specifically to protect their health. There was a study that started with a simple question nobody thought to ask before. Medication 7 is one that may genuinely shock you: Metformin, one of the most widely prescribed diabetes drugs in the world. Let me be precise here because nuance matters enormously. Some medicines used to treat diabetes leave the body through the kidneys, which means they can build up and cause extra side effects if the dose is too high for the kidney's current capacity. Metformin should generally be avoided if your estimated glomerular filtration rate falls below 30. The problem is not metformin itself for most patients. The problem is metformin combined with kidneys whose filtering capacity has silently declined without anyone rechecking. In a substantial fraction of older patients, a decrease in kidney filtering capacity is a consequence of age-related organ changes rather than intrinsic kidney disease. Yet this decline can have considerable consequences on drug metabolism and excretion, and can promote serious adverse drug reactions. This is why your kidney function needs to be tested regularly if you take any diabetes medication, not just once when the drug is first prescribed. Medication 8 brings us to a drug category that protects your heart but carries a hidden price for your kidneys under specific conditions. ACE inhibitors and ARBs, including medications like lisinopril, enalapril, and losartan. ACE inhibitors can benefit some kidney conditions, but can also reduce blood flow, worsening kidney problems, though their benefits for high blood pressure and heart failure often outweigh the risks. The key phrase is under specific conditions. When taken by a well-hydrated person with well-monitored kidney function, these medications are often beneficial. But when combined with an NSAID or during a bout of illness that causes dehydration, the interaction between these drugs and aging kidneys can spiral quickly. Let me ask you something. After hearing all of this, what is the one change you are going to make starting this week? Tell me in the comments below. I read every single one. And this is exactly why waiting is not an option. Medications 9 and 10 belong to a category most people over 60 encounter more than they expect. Number 9 is contrast dye, the substance injected before imaging procedures like CT scans, MRI scans, and cardiac catheterizations. You may not think of this as a medication in the traditional sense, but it absolutely is, and it carries significant kidney risk. When doctors use a dye to enhance CT or MRI images, in rare cases, this dye can cause serious conditions called contrast-induced nephropathy, which represents direct damage to kidney tissue. Patient-related risk factors that make this more dangerous include being over 60 years old, having underlying kidney insufficiency, volume depletion, diabetes, or heart failure. If your doctor ever orders imaging with contrast, ask specifically about your current kidney function and whether protective hydration protocols are being used. That one question could protect you from an entirely preventable injury. Number 10 is one that catches people most off guard, certain cholesterol-lowering medications, specifically at high doses. The statin family, atorvastatin, simvastatin, rosuvastatin, are among the most prescribed drugs on the planet. Many drug classes cause kidney complications, with the top categories including painkillers, antibiotics, proton pump inhibitors, antidiabetics, cholesterol medications, and agents for other chronic conditions. At standard doses, statins are generally considered safe for the kidneys. But at very high doses, and particularly in dehydrated older adults, they have been associated with a condition called rhabdomyolysis, a breakdown of muscle tissue that floods the kidneys with proteins they were not designed to filter in large quantities. The window for changing your risk is smaller than most people realize. Now, none of this is meant to make you fear your medicine cabinet or stop taking medications that are keeping you alive. That would be the wrong lesson. The right lesson is this: knowledge changes outcomes. And here is the framework that can genuinely protect you, starting today. Ask your doctor at your very next appointment for what is called an eGFR test. You should know your estimated glomerular filtration rate, which is the primary measurement of kidney function, and your urine albumin to creatinine ratio, which is a marker of early kidney damage. These two numbers paint a complete picture of where your kidneys are right now. Regular monitoring of your eGFR can help inform which medicines may need to be adjusted or switched to something different. This is not a complicated or expensive test. It shows up in standard blood work. Second, bring every single medication and supplement you take, every pill, every powder, every herbal capsule, to your next appointment and ask your doctor or pharmacist to review them specifically through a kidney safety lens. Patients with kidney disease are often prescribed multiple medications, and the aging process modifies drug interactions, including how drugs bind to receptors and how cells respond, making older patients with kidney concerns particularly susceptible to adverse drug reactions. Third, understand the power of hydration. To keep your kidneys safe, drink plenty of water, check your kidney function regularly, and follow your doctor's advice. Your kidneys filter roughly 50 gallons of blood every single day. They cannot do that work without adequate water moving through the system. Fourth, when you go grocery shopping, look for foods that naturally support kidney filtration, blueberries, which research associates with reduced oxidative stress in kidney tissue, cauliflower, which is low in potassium and kind to filtering membranes, egg whites, which provide protein without the phosphorus load that stresses compromised kidneys, and garlic, which contains compounds that support healthy circulation to renal tissue. These are not miracle cures. They are the daily maintenance that your kidneys deserve. Think about the people you love most in this world. Your children, your grandchildren, the friends you have breakfast with on Saturday mornings, the partner who has slept beside you for decades. Every one of those relationships, every single moment you still get to be present for, a birthday, a graduation, a quiet afternoon on the porch, depends in part on the health of two small, fist-sized organs sitting in your lower back that almost nobody thinks about until something goes wrong. Because kidney changes can happen without symptoms, many people do not know they have kidney disease until it is advanced, which is exactly why routine kidney checkups with simple blood and urine tests are recommended for adults over 60, especially those with other risk factors. You now know something that most people watching television tonight do not know. You know the names, you know the mechanisms, you know the questions to ask and the tests to request. That knowledge is worth more than any single prescription ever written because it gives you the one thing the medical system rarely offers automatically: control. In many cases, stopping or adjusting a medication early can reverse kidney damage before it becomes permanent. But that reversal only happens if you catch the problem before it has gone too far. Dr. Arthur Bennett has spent years bringing you exactly this kind of information, not to alarm you, but to arm you. Because the most powerful medicine I can offer you is understanding. Please share this with someone over 60 in your life today. It is not just health information. It is protection. It is time with the people you love. And that is worth everything. Do not forget to subscribe so that conversations like this one keep finding their way to you. There is so much more I want to share with you, and I am just